we offer treatment, and that treatment is for mitral regurgitation is to repair the valve. Now, replacement is a consideration for some patients, but we do know that when possible, mitral repair is not only better tolerated in the short term, but much, much better in the long term. And so to repair the valve, what we do is we reconstruct the leaflets. So we take those two areas that are potentially not coming together, and we either reconstruct them with artificial cords that have ruptured, or we take a small little segment out and bring the leaflets together so they come together nice and straight, and they come together, and then we support that with a special ring. In other words, we rebuild one of the doors and put a new door frame on. And that results in the leaflets becoming back to normal again. Our center is one of the top centers in the country that do a lot of mitral valve repair. And that can be done through an incision through the front called a sternotomy, or it can be done robotically, and that's done through a small incision on the side. Both are very, very commonly done here, and patients overall do extremely well, and these are generally low-risk operations. Mitral valve replacement occurs when patients have usually calcified disease or rust on the door frames, and the leaflets are rigid. And that's commonly associated with rheumatic fever when they were usually a child, or when their tissues are very, very rigid. And that's done by excising the areas of calcium and providing a new valve, which can be made out of cow or pig tissue or made out of metal. The cow or pig tissue valves don't necessarily require lifelong warfarin or Coumadin. The metal valves do require warfarin or Coumadin. There is a question that may be asked, is that when we do mitral valve repair, what valve type would you like? Those are really the reasons, and usually for valve repair, your surgeon will be able to tell you the percentage of repairability, which for mitral valve prolapse with no calcium is well over 95% in our institution. Now, the operation itself lasts approximately 4 hours, and you'll be in hospital for 4 days. Now, the key to success is lots of deep breathing exercises and lots of walking. And if you do extremely well, usually home into your own bed, no special arrangements, walking the hallways, and then just no heavy lifting or driving for about 3 weeks.